What up? 大家好，我是锁头。We want to thank you guys for all your donation and your support on our 2 黄标 videos. And just a reminder, it'll be Tuesday before the jury comes back with its final verdict. But until then, many of you guys have been requesting the Shannon Curry rebuttal testimony. Now, a rebuttal is a legal term which means to publicly make a statement to defend and reply to someone who is attacking your point of view. In America, this is most commonly used in political debates and in courtroom settings. So Shannon Curry's rebuttal is in direct response to Dr. Dawn Hughes' expert witness testimony, where she criticized Dr. Curry's diagnosis. Now, there are a lot of technical terms, and because we want you to fully focus on what she is saying, I will only cut in once in the middle. And whenever Dr. Curry mentions the CAPS-5, she is referring to the standardized tests used in America to measure the severity of PTSD in patients. It is most commonly used by the US government when evaluating soldiers after war.
Forensic psychologist, and I'm here today to rebut the testimony that was provided by Dr. Hughes.
Which of the opinions rendered by Dr. Hughes do you intend to rebut?
So generally speaking, there are 3 main categories that I'd like to talk about today. So the first is that Dr. Hughes misrepresented the tests and the results that she utilized in her evaluation. She misrepresented my testing and the results that I obtained in my evaluation. And she communicated in a manner, provided testimony in a manner that presented essentially her own opinions and the self-report of Ms. Heard as facts.
Okay, the first category you talked about was the misrepresentation of her own test methods and results. What do you mean by that?
So Dr. Hughes she stated that she administered 12 tests. In actuality, she used 8 checklists. About half of those were symptom checklists, the other half were checklists about experiences that people can have with domestic violence, and those are not appropriate for forensic settings. They are easily exploited.
Other issues that you intend to address relative to misrepresentation of own results?
Yes, so in addition to using these checklist measures, which are easily exploited in a forensic context, they're developed for research or treatment only. She also stated that these checklists revealed things that they simply cannot reveal, especially in this context. Let's see. She also misrepresented information, clear indications on several of the objective measures that she offered. And there were indications visible that Ms. Heard had essentially engaged in what we call response distortion. So clear indications of exaggeration on one of the measures that's specific to PTSD, clear minimization of symptoms intentional on another more broad personality and psychopathology based measure that she gave to Ms. Heard, which she did not acknowledge.
Did you intend to address anything relative to the CAPS-5?
I did. So Dr. Hughes administered the CAPS-5 about 10 days after I did, almost 2 years after she initially tested Ms. Heard. And she did not administer the test appropriately. So she left major components blank. She didn't apply the scoring rules that are clearly outlined with the test. And yet she diagnosed Ms. Heard with PTSD based on that assessment.
What about Dr. Hughes' use of the personality assessment inventory?
So of the tests that Dr. Hughes administered, 2 would be considered, of those 12, 2 would be considered what we call forensically relevant instruments, meaning that they're objective enough and they provide us with some information about how the examinee approached the test, that it would be appropriate for this setting where the examinee is going to have a natural incentive to present themselves in a way that benefits the outcome of their case. Now, on the PAI, there were clear indications that Ms. Heard was responding and obtained scores in a manner that's consistent with individuals who have a personality disorder. And there was also an indication that several scales, we call this a configuration. So you might have one main scale that you notice is elevated, then you look for additional subscale information to get additional information on what could be elevating that scale. And there was a configuration that showed that even though Ms. Heard had moderately elevated one of the skills that can be associated with trauma, that elevation is better explained by childhood or distant traumatic experiences like the complex trauma Ms. Heard reported experiencing growing up.
So in this next part, Dr. Curry is going to explain how Dr. Hughes inappropriately used checklists in patient analysis.
You said Dr. Hughes utilized checklists that are not appropriate for forensic analysis. Can you explain that?
Yes. So as I said, in any sort of forensic context, whether it's a civil or a criminal matter, a person who's being evaluated is going to have major incentive to present in a way that benefits the outcome of their case. So you always approach the examination, I believe Dr. Hughes said, with a healthy dose of skepticism, but that alone is not enough. We have to operationalize that. So we actually have to administer very comprehensive objective tests that either control for attempts to manipulate the test results or reveal attempts to manipulate the test results, so that we're not just blindly accepting the results or the self-report of the examinee.
How many tests were administered by Dr. Hughes?
She said that she administered 12 tests.
How many of them were appropriate for forensic physical examination?
So the trauma symptom inventory is appropriate. It's an objective measure, and it does have two primary scales that look at how the person approached the test. The personality assessment inventory is an excellent test. It is a broadband measure, meaning that it captures not only symptoms of mental illness, but also general personality traits. That also gives us pretty detailed scales similar to that one test I administered, the MMPI, that tell us a lot of nuanced information about the way the person approached the test. She also administered a malingering screen that can be very, very useful, but not in this context. So it's called the Miller Forensic Assessment Symptom Test. It's a brief set of questions that you ask the examinee, and it's been shown by research to be extremely effective at identifying an examinee's attempts to fake a severe mental illness or psychosis. And psychosis is when somebody loses complete connection with reality. It's excellent for that purpose. It's actually been shown in the research to not be effective at all for identifying a respondent's attempts to fake PTSD, anxiety, or mood disorders. The questions are just too odd for somebody who has the wherewithal to be trying to have PTSD to endorse. They see through it. So she used that. That's a fine test, but not appropriate for this context.
Of the various tests that she administered, how many were these checklists?
8 of them.
All right, and what are you talking about specifically?
Okay, so I had mentioned that there were 2 main categories of checklists she used. The first is the symptom checklists. Those included the Beck Depression Inventory. It's a brief inventory of items that essentially show all of the symptoms of depression that a person might have, and you rate which level of severity you have for each question. She also gave the Beck Anxiety Inventory, very similar, but just with questions about anxiety. She gave the Mood Disorder Questionnaire, which is a very brief, again, checklist. It shows symptoms of bipolar disorder. Bipolar disorder is a mood disorder where you might have an extended manic episode and then a very extended depressive episode. And then she gave the Post-Traumatic Stress Disorder Checklist, and that is a screening instrument only. It contains every single symptom of PTSD. So there's a secondary danger here too. When you think about it, given that PTSD is the most frequently feigned and claimed diagnosis in civil courts, if you're handing somebody a checklist that lists every single symptom of PTSD, you're essentially teaching them all the little nuances that we're looking for to give that diagnosis. So she gave that to Ms. Heard. Ms. Heard endorsed most of the items, and Dr. Hughes diagnosed her with PTSD and substantiated that opinion by Ms. Heard's checking those items on the PCL-5.
Very well said, Dr. Curry. Now, this is only the first part of her rebuttal. In the next episode, Dr. Curry is going to explain in greater detail where Dawn Hughes went wrong and how she could have done better in her assessment. So stick around for that, smash that like button, and we'll see you on the flip side. Peace!